Keiji Fukuda is an American epidemiologist who's helped lead the UN response to some of the world's biggest health challenges, like Ebola in 2014 when it returned to West Africa.
I think the Ebola outbreak was probably the hardest outbreak that I worked on in my career. And the reason for that is that, one, Ebola is a very difficult disease anyways, but the whole area where we were working in is a quite impoverished area. And the sense of fear, the sense of isolation was very strong. And I think that, this is really what I remember from that outbreak in many ways. But on the other hand, it also was countered by a terrific sense of courage and resilience. I saw communities come together. So emotionally, I think that that combination of seeing courage but also fear and isolation was very striking for me.
Ebola has earned a reputation for returning to communities even after long absences. Do you worry that other diseases that we think we've consigned to history will do the same?
I think that trying to predict the future about what diseases we're going to see is a very difficult disease or a very difficult game to play. Rather, what I focus on now, after some decades of working in this, is how do we get ready? Because we can't predict. Maybe an old disease, maybe a new disease, but there are things that we can do to get our countries more prepared, our communities more prepared, and this is what I think that we should focus on.
You've lived and worked in China, notably during the emergence of SARS. Do approaches to health and science differ fundamentally in the US and China, and do they collaborate effectively?
This is a good question. I think that when I look at science, I think science is generally a universal language around the world. Whether you're in the United States or in China or another country, the language of science is very much similar. Health is different. I think that depending on the country that you're in, the philosophy behind the health can differ. So for example, China has a very societal perspective. In China, much of the thinking goes on how do we protect the entire population. In the United States, there's a very individual focus and a lot of focus on technology. So yes, we need to bring the science and our approach to health together to collaborate better. But I think that in order for that to happen, we also need people to support science and health working together. We need politicians, we need all levels of society to say we want these things to collaborate.
What happens if the US and China collaborate more closely? Will it necessarily have a big impact on human health and human breakthroughs?
It will have a huge impact for the positive if both of the countries can cooperate and go forward. These are the two countries which are going to shape the directions of the world for much of our foreseeable future. And for them to collaborate, it will go beyond health. I think that it is really a big hope for me that these countries will find the way to really join hands and steer the rest of the world, because they are going to influence human history for quite a long time.
Keiji, what health innovations give you evidence for hope for the global future?
I think that the biggest evidence for hope is that there is a growing awareness around the world, both in the scientific world but more broadly, that health is interconnected with virtually anything, with the climate, with the environment, with the microbiome, with how we eat food. And the reason why this is so important is that we now see that all of these things impact our mental health, our emotional health, our physical health. And by seeing these connections, this is also how we're going to achieve greater wellness around the world.
Keiji, you care deeply for people, and like your parents who are also doctors, you use your skills to help improve the human condition. But how can everyone participate regardless of their background?
We need one fundamental thing. A truth of being a human being is that we are all much more alike than we are different. This is true in no matter what country you live in, what community you live in. And I think acting upon that fundamental truth is the basis for how we will go forward and we will do better. That, for me, is one of the lessons of my life. This is what we need to do better. But more recently, I've also begun to work with some organizations like the China Medical Board. And one of the things which I am becoming deeply involved in is the idea that we can connect people, and this is the basis for addressing equity and improving fairness.
From the Well is a new series with global leaders, brought to you by the China Current and Tsinghua Vanke School of Public Health.